areas of Banks, North Plains, Hillsborough, and Beaverton. I am incredibly honored to be here with such an amazing panel of speakers. And I want to say thank you to Maria Johnson. She is an ASL interpreter in the community who is providing us this opportunity to broaden our outreach in our community with this really incredibly critical piece of information for folks. The goals of this town hall are to make sure that folks feel informed, to make sure that we provide resources and information. There is opportunities for you to ask questions. This is being streamed on Facebook, on the Sheriff's Facebook, I believe, and the Washington County DA's Facebook. So those are, it is being streamed live. We also have the chat feature. So if you kind of take your mouse and go to the bottom bar where you see chat, you can open up that feature and be able to send a question to us so that we can then we'll answer through Facebook Live questions that come through. We have folks that are monitoring that. And then we'll also answer questions through the Zoom chat. And we want to encourage you to ask those questions because we want to make sure that this is a good two-way conversation of folks to get information. I want to just say I am personally incredibly honored and to bring this topic forward. This is a personal topic for me. I grew up in a home where domestic violence was prevalent, and I want to make sure that folks know that they are not alone in these situations, and there is opportunities to be a survivor and to be to gain support. I want to say that this current crisis situation leads us into many issues with domestic violence, with child abuse. We not only have the added stress of the crisis itself and people experiencing loss of job or income, all sorts of different types of stress that affect a household. But we also have confined quarters, people are all under one roof. And I think that there's also substance abuse concerns. I know that for my dad, when he would drink, it fueled his rage. And so I do know that that is something that it enters into this conversation as well. Without being called into a special session, the legislature has a very limited scope of control over support in this arena. We have very limited access to dollars. So we did have emergency board dollars that we were able to allot in the tune of $2 million that will be used for housing vouchers and such for victims of domestic violence and sexual violence. That is currently still in the process of being allocated, but I know that that was something that we were able to provide with emergency funding that we had. So once we go into special session, then there are other actions that the legislature can take to address the many different issues that we are facing in this crisis situation. Today, I just am really appreciative of gathering the professionals, the folks that are on the front lines, the folks that are doing this work to provide this incredible information for us to listen to have questions that you may have be answered. So I want to just give them a brief opportunity before we go into a presentation. I want to just give them a brief opportunity to introduce themselves and what organization that they are with. So if we could start with Sheriff Garrett.
Good afternoon, and my sincere thanks to Representative Sollman for convening this town hall, and in particular for sharing some of your really important history that's so relevant to today's discussion. I'm Sheriff Pat Garrett, and your Sheriff's Office does three basic things. We are a main law enforcement provider to include patrol, investigations, and forensics. We run the county's only jail. founded on a principle of direct supervision. It's the most safe way to run a jail. And we also prioritize programming or classes because we know that our adults in custody who complete those programs reoffend at a lower rate. And then 3, we are the court's enforcement arm, or the only agency in the county to serve subpoenas and restraining orders, child custody documents, emergency response protection orders. Those are the kind of the 3 main areas at the Sheriff's Office, and it's just my honor to be with you today. Thank you.
Thank you, Sheriff. DA, Kevin Barton.
Yes, hello, and thank you, Representative Sollman, for convening this. I echo the Sheriff's appreciation for bringing us together for this important topic. I'm the District Attorney for Washington County, and I run an office of 130 people here in the DA's office. We prosecute all crimes that happen throughout Washington County, investigated by various law enforcement agencies throughout the county. That includes domestic violence and child abuse, which we'll talk about today, but all sorts of other crimes as well. Our mission in the DA's office is seeking justice and protecting our community, which means seeking justice is always doing the right thing for the right reason. And protecting our community is an emphasis that every decision we make in the DA's office has a connection to public safety, to keeping people safe so that they can live, work, and raise a family. And we can't do any of that alone. We do that in collaboration with our partners, many of whom are on this call right now. So thank you.
Thank you. Tony?
I'm Tony Locke. I'm the Executive Director of the Family Justice Center of Washington County. And we are a relatively new agency. We're about 2 years old. We are a one-stop shop for victims of domestic violence. So what we've done is we've brought in 11 different partners under one roof. So when somebody does make that decision to leave, they can come here, and what would normally take days to get done can be done in a matter of hours. So it's really, a wonderful opportunity for people to get in here, get what they need. And a lot of times they don't even know what they could access. So that's one of the beauties of the Family Justice Center, is getting to know access of other services.
Thank you, Tony. Rowie?
Hi, I'm Rowie Taylor. I'm very honored and humbled to be the Executive Director at the Domestic Violence Resource Center. Our organization's been providing support services, housing support services to victims, survivors of domestic violence since 1975. And I'd really like to thank you, Representative Sollman, for pulling this town hall together, for inviting me to be part of it, and most of all, for your courage and how brave you are and talking about your story. Everybody needs to be able to tell their story. Thank you.
Thank you, Rowie. Kevin?
Sure. I just want to echo people's thanks to you, Representative Sollman, for bringing us all together and then including CARES in this opportunity. CARES Northwest, I work as the Executive Director at CARES Northwest, and CARES Northwest is the Children's Advocacy Center for Washington County. We've been serving in that capacity since 1987. And for those that don't know what a Children's Advocacy Center is, our job is really to bring a whole bunch of different professionals together in responding to child abuse. And our goal is to be able to do that in a coordinated way, in a location that's child friendly, and in a way that minimizes trauma to the children and families we serve. As a quick aside, we've been serving Multnomah and Washington County children since 1987. And for the first 31 years of our existence, we always saw more Multnomah County children than Washington County children, but that's changed. Wow. In the last 2 years, we've been seeing more children from Washington County than Multnomah County. And that's one of the reasons why I so appreciate you helping bring attention to this issue. Well, thank you for including us.
Thank you. Thank you all. And as you can see, we have really just a wealth of knowledge here of folks that are working on these issues. So I really appreciate their time for being here. I want to just say on a side note that the DA and Tony and I share, we are on the Family Justice Board, Tony being the Executive Director, and we are on the Family Justice Center Board and talking so much about the issues that we are facing here in Washington County. So I'm really privileged to be in that position and be at that table as well. And I know that Sheriff Garrett and I we are on the commission for the Alcohol, Drug, and Policy Commission, because once again, many of the issues that we face in Oregon are not siloed issues. They are all connected in different ways. And, you know, it is just important that we really have such a robust conversation, a robust group of professionals that really look at these issues and how we can better serve folks that are facing crisis. So I'm very honored to have such a great group, and I will kick it off to you, Sheriff, to be able to talk about, you know, our Washington County response to these issues. Thank you.
Thank you, Representative Sollman. So we recently looked at the average domestic violence calls for service that we respond to for March and April of this year and compared them to the previous 3-year average. And what we're seeing is that they're down about 13% in March and April of this year compared to the average for the 3 previous years. And while that's informative, it doesn't begin to paint the picture of the current reality with respect to people at risk or survivors of domestic violence being less able to access resources, to break free, to get the time and the space that they need to contact our really important service providers like the Family Justice Center and the Domestic Violence Resource Center to make a plan and to have the opportunity to break free. We know that from our own work in the community that when people are closed up, are at home during our stay-at-home executive order, that's going to magnify the problems around domestic violence in our community. So we're just paying really close attention to when we do respond, because we're still at work, we're still responding to calls, we're reaching out where we have information that there may be a domestic violence issue, and just doing the very best that we can to ensure that survivors and those at risk have the information they need, or if we need to help them literally move them from point A to point B to get safe and then access services, that we do that. We also have a domestic violence response team. Those are deputies who are especially trained to investigate and respond to domestic violence cases, do follow up. They screen all domestic violence reports that we take. And they are focused now more than ever, understanding the current situation that we're in and the increased risk to domestic violence survivors. As Representative Sollman indicated earlier, she and I are on the Governor's Alcohol and Drug Policy Commission, and an element that plays into this unfortunate circumstance with respect to community safety around child abuse and domestic violence is that we are seeing addiction rates on the rise, substance use disorder and substance misuse. And as a colleague of mine, Dr. Brad Anderson, Chief of Addiction Medicine at the Oregon Health Sciences University, recently said, you know, addiction dies in community. When people who are suffering with substance use disorder are able to access group, mentors, people in recovery, addiction dies in community. Addiction thrives in isolation, and that's just one element that is contributing, in our view, to the risk that our domestic violence survivors face today, and those at risk of child abuse as well. When it comes to child abuse, so the Sheriff's Office, like every other law enforcement agency, we review Oregon Department of Human Services reports of possible child abuse. That's on a form. It's very well known to every police officer in Oregon, and that's a DHS Form 307. And if we look at April's 307s that came into our office to review and assign out to do a welfare check or an investigation, the rate of those forms coming in our office for follow-up is down 50% compared to the average for the 3 previous years. And I think I will just stop there because District Attorney Barton has some really, really important stats and context when it comes to the statewide hotline and their own role in charging. So I think I might just break there, Representative, if that's okay.
Well, I think that's passing the baton to me. Thanks, Sheriff Garrett, for that. If I could summarize what's happening in one sentence, I would say that what we're seeing is a difference between what's reported and what's actually happening in homes. And when we have a difference between what is being reported to the outside world and what's happening in homes, that's where a true danger exists. And we know that violence in the home, whether it's domestic violence between maybe a boyfriend and a girlfriend or a husband and a wife, between intimate partners, we know domestic violence and child violence, abuse, sexual abuse, physical abuse, or neglect of children, all of that thrives in the shadows. It thrives behind closed doors. And the ingredients of that familial violence, those ingredients include things like social isolation and stress, which are the things that we're seeing in our community for the past 2 months. And so with respect to both DV and child abuse, the numbers are down. The numbers of what's reported for domestic violence in Washington County is down, as the sheriff mentioned, compared to years previous. And we're seeing that not just in the reports to law enforcement, the calls to police. We're seeing that in a drop of people applying for restraining orders. That's another indicator of people who are seeking help for domestic violence. Those numbers are down. The number of people visiting our Family Justice Center, those numbers are down. The number of domestic violence cases coming to the DA's office for prosecution, those numbers are either down or close to where they were in previous years when we know that the number of people that need help has increased. And with child abuse, violence in the home to children, the numbers are even starker. So when we look at what's known as the mandatory reporter calls, the calls to DHS hotline, the calls of reporting child abuse when it first occurs, those numbers in Washington County dropped by half starting the very same week that the schools shut down. And it's literally like a light switch being turned off and creating that environment where these children aren't able to seek the help and the support that they need. And the numbers have remained significantly down by about half in terms of the reporting of child abuse in Washington County. When we look at the number of the children that have received medical treatment at CARES, which I know Kevin Dowling will talk about in a moment, those numbers are down also. When we look at the child abuse cases coming to the DA's office for prosecution, those numbers are also down by half. So what we're seeing is that suddenly domestic violence and child abuse as reported has dropped, but we know that domestic violence and child abuse is still continuing. And the only anecdote we can have toward that is sunlight, shining the light of day on what's happening behind closed doors and encouraging people, if they see something, to say something and report it, and hopefully encouraging victims and survivors to seek the help that they need.
Thank you, Kevin. I just really want to reflect on what you had just, one of the things that you just said is shining the light of what's happening behind closed doors. And I just want to tell you from the survivor's lens that that is something that is incredibly important in this discussion, because we don't know what goes on behind closed doors. And I know growing up that a community didn't know what was happening within our own home. And so I think the more opportunities that we can have these conversations and shed the light on the professionals that are available to help and just provide that, I think that is just so incredibly critical. So I will punt it to Tony.
Oh, thank you. Yes, as Kevin said, we have a little less in terms of people coming to the Justice Center. We still get lots of phone calls. We still get people in. Most of our partners are working remotely. So what we've really been able to do is connect those people to the right resources. Because when somebody makes that decision to make a move, we want to be able to enable them and empower them to do what it is they need to do. So with all of our partners, we have 3 law enforcement. The Sheriff's Department is there, Hillsborough and Beaverton. Domestic Violence Resource Center is here. And we have various groups, a couple of law centers and those kinds of things, so that there's civil law, there's criminal law for Kevin, and there's just different ways of helping people get out of the situation, because they're don't necessarily know what else they can have to get out of there, and they might need assistance. So we help with getting restraining orders. We help with connecting them to the attorneys, to law enforcement. So it's still crucial that we're here, in that we want to make sure that when somebody makes that call, we're here to be able to deal with it. We certainly are concerned about, I would assume, and I would think that's true, that the severity of domestic violence right now is getting worse. And just across the country, there's a huge increase in murder suicides. So while we don't hear from them, I think that they are so isolated and not able to reach out or get out that we're going to have an onslaught of people coming in for services once the ban is lifted or the stay-at-home order is lifted.
Okay, thank you. And
Yeah.
Rowie?
Well, I'd like to, obviously I can echo what everybody's already said, but what I'd really like to share with you is that DVRC has operated a domestic violence crisis line for over 40 years. That from January 1 to April 30th this year, the first quarter of the year, we more than doubled the phone calls that came in on that crisis line from all of 2019. Now, most of those calls the first month, truthfully, more than half of them were not domestic violence oriented at all. They were people that were afraid of getting evicted. How were they going to pay their rent? Could we help them with that? How were they going to feed their kids? They were running out of money. They were running out of food. There were quite a few calls from homeless men who wanted someplace to go but didn't want to go to a shelter because they were afraid. And did we have any resources or information there? In the last month, we've seen where most of the calls are domestic violence related, where people really were looking for help with establishing safety plans. People not wanting to leave their house right now, being afraid to leave their house because they didn't want to get sick. They didn't want their children to get sick, but they definitely knew they needed a safety plan. And how could we assist them with that, and also being connected to other resources, lots of information for legal resources. So Oregon Law Center and the Victim Rights Law Center, and lots of information and referrals there. But that the calls to our hotline, our crisis hotline, truthfully, were not about, generally not about seeking shelter where they want to leave right now. Some calls about restraining orders, but not for right now. That's what they're going to want to get in the future. People have been thrilled to learn, though, that they can work to get a restraining order over the telephone. That made them feel much better, that they didn't have to leave. Leaving their homes is really frightening for people right now.
Thank you, Rowie. Kevin?
I just wanted to start with just thinking about your guys' comments about shining a light and just thinking about children that we serve and how they're such a unique population in that they rely so much on us as adults to speak up on their behalf. And when I think about the kids that we serve, I think like little babies, they're not able to call 911 to get help. 8-year-olds aren't able to drive across town to go to the grandparents' house when things get unsafe at home. And even 16-year-olds can't vote to change the laws that could help keep them more safe. They're a unique population because they really rely on us as adults to speak up. And I know it's hard in our society to speak up sometimes when you're worried, but when it comes to children, when you think of all the people that normally have eyes on those kids, schools, daycare, loving grandmas and grandpas, medical providers, and they're just not there. And so I really encourage our community to step up and help kind of be that voice for kids that don't have a voice themselves. At CARES, what we've seen is initially a dramatic drop in the number of children that we were seeing with the child abuse medical evaluation. So normally we'd see 30 or more children a week. And in mid-March, with the stay-at-home order and schools closing, we went from about 30 a week, with a little over half those kids coming from Washington County, to 4 that first week. And we've gradually been building back up as we have figured out new ways to serve kids and ways to keep our patients and families, community partners, and our staff safe when we're serving those kids. We transitioned all of our in-person trauma therapy appointments to remote therapy. And it's been interesting to watch through all the challenges. There's also, I want to emphasize some silver linings that have kind of come through. For instance, in trauma therapy, we've had opportunities where kids have taken their laptop and kind of showed therapists around their house and got to see what their bedroom looks like or what the family's music room looks like. Or we've had kids that might have a hard time talking about the trauma they've experienced, but they're using the chat feature of that secure online remote therapy to chat about things that maybe they'd have a hard time talking about. So, last week we saw about 20 children, so we're slowly building up to the 30 children a week. We're starting to see kids in person for trauma therapy, but I think this is going to be a long road ahead of us, and I think it's really up to all of us to help those people who are vulnerable in those homes while we're working on this together.
Thank you, Kevin. I know that we have one of our first questions that have popped up in the chat, so I want to share. Crystal is asking, what is, and I'm not certain who would feel comfortable in taking this, so it just says, what is your office doing to keeping families together during this time rather than separating them? So it might be a couple of different lens here of people, how they can share that, that answer. If that's.
So I can talk about one of the things at CARES Northwest that we've started doing that we weren't doing to the same degree. So when we're only able to see half the number of kids that we normally see, that means you've got a whole bunch of families that are waiting for appointments. And just what we were talking about earlier, you can imagine the stress in those homes, especially if you're concerned that your child's being abused. So we have had a team of our staff reaching out to those families and checking with those families and seeing what kinds of resources that they need. For families that are scheduled for appointments, we have what we call a navigator role that really checks in with the family before the appointment, during the appointment, and then helps them connect to resources after the appointment. For instance, there was one child that her cell phone broke, and that was her main way of staying in touch with her father and her family, and we were able to use funds to help her get another cell phone to stay in contact with the people that she loves and people that help protect her. So those are some examples of kind of what we've been doing here at CARES.
I can talk about the DA's office perspective. I've always said that an important part of being safe is feeling safe. And one important way of keeping families together is making sure that everyone in the family feels safe, whether that's safe from a domestic violence scenario, safe from a child abuse scenario, or just safe in the sense that you feel like there's the ability to be safe in your home, have food on the table, and have a stable living environment. All of those types of safety play into, if you feel that way, then you actually have a sense of togetherness and you can live in safety in your home. And so we do many things in that regard. In addition to working with all the partners that you see here on this Zoom chat, we have a child abuse multidisciplinary team, which is a group of professionals that come together monthly and still are coming together in a virtual format monthly. Doctors, nurses, psychologists, social workers, police officers, et cetera, teachers, to make sure that children are safe in their home. We also have a child support enforcement division where we ensure that parents who are owed money to make sure that they can provide food on the table for their kids actually receive that money so that the family remains stable and solid. And last year, for example, we actually collected a little over $35 million for Washington County families. So it's a small piece of the puzzle that we work in collaboration with other partners on, but it definitely is part of the overall mission of keeping people together and safe.
Thank you. Yep, Rowan.
One of the things that I really would like to thank you and the state of Oregon for is the Housing Stability Fund that's been established for survivors of sexual assault and domestic violence. And it has been amazingly wonderful and beneficial. And that has definitely helped to keep families safe. It's taken a lot of the hoops away that normally we have to jump through to be able to document reasons for needing the funds. So it takes longer, and it's really shortened that time period. And we've been able to provide assistance to families in ways that we never have before. And so I know on behalf of SARC And on behalf of DVRC, that's been a real lifesaver. And we're partners at the Family Justice Center, so that goes along with that continuum, that full continuum of services that are able to be provided by folks that either contact our agencies directly or go to the Family Justice Center. But kudos to the state for that. That has been wonderful. Thank you.
Thank you. I think I saw the sheriff. Yep.
Yes, thank you, Representative Sollman. And to add to Roe's excellent point, the governor suspended all evictions for non-payment of rent, which it helps us keep families together and a roof over their heads. In addition, at the sheriff's office, we have suspended all judicial foreclosures. It's really for the same reason as the state has suspended non-payment evictions. And then we have food boxes where we help, keep food on the table, literally, where we come across families in need. I guess that's helpful. Thank you.
Thank you.
And I think the last thing I'd like to bring up is just safety planning. If they have to stay in the home, that there's some safety planning done with them in order to stay safe in the home.
Thank you. Yeah, and I think you all have touched on too that there's so many different issues that factor into this, whether we're talking about housing, whether we're talking about food insecurity,
Right.
and the partners that are coming together to help support, and whether that partner is also the state, as Roe pointed out, or whether it's community action or the food to go program in Hillsborough as well, or what you had discussed as well, Sheriff. I think that's all about supporting that family unit. And I think, Kevin, something that you kind of touched on too is that what we need to kind of look at is that not all domestic, or specifically child abuse happens within that home. That trauma could have happened somewhere else, and the support needs to come to the home to help that child in working through this. And so I think that's, I thank you for bringing that up. I'm hoping that someone could maybe talk about during this, and then we'll go back to looking at some questions here too, but I think Tony had brought up about the restraining order process. And I know that looks a little differently right now. I just didn't know if you could talk a little bit about a person's experience when they're coming in and what that looks like.
Sure. Well, we are offering the restraining order packet for people to take with them. Our strong partner that helps get the restraining orders done is DVRC. So we're really here to help them. This morning we had somebody in that didn't speak or write Spanish, but needed a restraining order. And there was somebody here that helped them out. They did it all by the phone and got it taken care of. But really what we can do is send it off to an advocate for final approval, and then they can e-file it. But I would say of all the things that people are coming to us for at the Justice Center, I would say probably 80 to 90% are restraining orders.
Okay, thank you. And I don't know if anyone else wants to touch on restraining orders. Rowie?
I'd love to. Restraining orders are so important, and it's really a very, very important tool for people to have. But without the safety planning that goes along with that and the other wraparound support services, it becomes less a less meaningful tool for people and more of a piece of paper in some folks' mind. They really need to have the full continuum of support services. And that's the beauty, in my mind, of an organization like a Family Justice Center, because there are different partners there. We're all there at the same time. We can help with the protective order process. We can help with safety planning, but there's the legal aspect and the law enforcement aspect, and it's a full continuum. So it's not that I want to just keep beating the drum for how important the Family Justice Center is, but the concept, much like children's advocacy services, it works, and it's just what we need to be able to have in our community.
Thank you, Rowie. Anyone else want to add to that, or can we go on? Okay, the sheriff?
Yes, real quick. Even the courts have recognized the importance to make restraining orders as accessible as possible to
Right.
survivors. we are receiving restraining orders now electronically from the courts to our civil unit for us to serve them. And before sometimes there was a small delay because we had to wait for the certified true copy to come, the hard copy. That's not the case right now. They're just coming straight over electronically, and we're getting out the door and we're serving them really, really timely as we can.
Thank you. Okay, so the next question I think is going to be geared toward CARES. Alice is asking the type of training that CARES Northwest child abuse investigators received. Do they receive like a special certification?
Oh, that's a great question. Thank you for asking it. So we have a whole bunch of different professionals that work here at CARES. We have medical providers that range from pediatricians that have a subspecialty in child abuse. So in the field of pediatrics, just like they might have subspecialties in oncology or cardiology, child abuse is a subspecialty. And so we have multiple pediatricians here on staff with that child abuse subspecialty. We also have other physicians and nurse practitioners that have extensive experience in seeing kids for concerns of abuse. There's a lengthy training program that people have when they come to CARES that involves, if you're a medical provider, involves observing a lot of evaluations and having your work reviewed. We have master's level clinicians that work here that work in a variety of roles, from what we call forensic interviews. So they need a master's degree to be in that role in the first place. And then again, there's months of training when they come here in how to talk to kids in a neutral way during that child abuse evaluation. We have master's level clinicians that provide family support services. We have master's level clinicians that provide intake, counseling, and triage of those referrals. So one of my favorite things, I've worked here at CARES for about 25 years, and one of my favorite things is just to get to work with all those professionals that are so passionate and have really dedicated much of their careers to learning how to help kids in these situations, and dedicated themselves to working collaboratively in that work to hopefully minimize trauma to kids.
Kevin, don't forget to mention the 2 four-legged employees that you have as well.
Yeah, they have extensive training too. We have 2 facility dogs, Harmony and Tona, that actually work here full-time. And they have extensive training through a program out of Northern California called Canine Companions. And it is amazing to see what those facility dogs can do to help kids, whether in trauma therapy, or we had a child that was here that really was suicidal and was having a hard time. All of us adults weren't able to help kind of support her in getting over to the children's emergency department. And darn it, if one of those facility dogs, if Tona didn't come up and was able to do what all of us adults weren't able to do. And with Tona by her side, that young girl walked across the street over to the emergency department with about 5 security officers about 20 yards behind them. But yes, I don't know what kind of training they have, but boy, they're really good with kids.
Therapy dogs are amazing. I mean, the work they do, particularly with the elderly also. Great work with the elderly.
Absolutely. I appreciate you bringing that up, because at that moment, I think my own dog, my 12-pound therapy to me, Jack Russell Beagle, sounded the horns for her appreciation. So I want to say that we've been seeing that for, kids in the hospital, through this whole crisis, the therapy dogs that are coming in and helping these kids through that traumatic experience. So that's pretty exciting to hear about how CARES Northwest is utilizing those therapy animals. Let's see. It says, what would be the benefit of having CARES Northwest and the Family Justice Center under one roof? Is there direct ties to domestic violence and child abuse?
I think it would be a great benefit to have the 2 together. Just having a campus of having those 2 agencies, ours and CARES Northwest, really looking at the trauma all the things that are brought to play when you're talking about domestic violence and child abuse. And I think that people then know where, if there's an issue about abuse, this is the place to go. So there's not necessarily a question mark, where do I go for that?
I agree with Tony. When I think, oh, sorry, Kevin, do you want to go?
After you, go ahead.
I was just going to say, I agree with Tony in that when I think of the children that we see here at CARES Northwest, almost half of them, there's some history of domestic violence that they've experienced. And so it's violence in the home. And the more that we can bring professionals together that are working in that area, I think the better that we're able to serve children and families, both by sharing that expertise, by not having them go from different location to different location to different location to figure out these systems. We can make that a lot easier for them. And then also people, I think, who work in this field, you can feel pretty isolated. And so having other colleagues that are passionate about reducing violence in families around to work with, I think is a tremendous asset and helps with keeping staff in these jobs. So I think that would be a great idea.
And I want to echo that and say, absolutely. Whoever asked that question, thank you for asking that question. And it really hits on two things to me. Number one, CARE's current primary location is in North Portland. It's on the campus of Randall Children's Hospital. And it's there because as Kevin mentioned, for years, for decades, most of the children that CARES saw came from Portland and Multnomah County. But what we're seeing now is a significant demographic shift here in the Portland metro area, where a lot of the younger families that have kids have moved to and are raising those children in Washington County. So even though Washington County's overall population is closer to 600,000 and Multnomah County is closer to 800,000, if you look at the child population, it's only about 13,000 different children in Multnomah County. In other words, Washington County is catching up to and will soon overtake Multnomah County in the child population. And we're already seeing that, sadly, in the numbers. The fact that CARES sees more Washington County kids than they do Multnomah County kids. So not only do we need to bring CARES so they have a permanent large facility in Washington County for our children, but the best practice would be to co-locate that with the Family Justice Center so that families go to one spot. If the child's been exposed to domestic violence, then the child and the child's mother can come to the FJC. The mother can get the services that she deserves as a domestic violence survivor. The child can get the support that she needs as a child abuse victim who's been exposed to that trauma in the home. And then it helps strengthen the family so we can have a strong family unit moving forward.
Thank you. Go ahead, Roy.
Well, I'd like to echo what Kevin just said, but I'd like to also add on to it and bring in sexual assault also, because unfortunately, domestic violence, sexual assault, and child abuse and neglect, unfortunately, all go together. And it would be wonderful to really have all three of those areas to be under one roof with support services for survivors, for victims and survivors. I'd love to see that. I think that would be wonderful.
Well, and I think that the point is too, is when people are facing crisis and they're in that mode, it's very difficult for them to think about going to different buildings, different areas for support. And we think about some of our doctor's offices. When someone is sick, some of our doctor's offices have incorporated the lab there. Some of them have physical therapy there, so that their patients that are being seen in this situation are not having to go across town, miss more work, and so on and so forth, which is, even a beauty of our school-based health centers in our school districts, and being able to have those school-based health centers on the grounds of a school. It gives those opportunity for access for kids and for staff members to go there and be supported in their health care. So I think it's great to mention that the Family Justice Center, if only I had this beautiful Zoom ability to go and take you through the walkthrough right now with the Family Justice Center. It's not just, little rooms that are set up in stark and dark. I mean, there's child activities, There is childcare providers that are there to help. Like I said, like everyone has mentioned, the ability to have all of those professionals under one roof and to support these kids, these victims of sexual violence, victims of domestic violence, to welcome them into a welcoming environment is critical as well. And whether that's just even the first hello to coming through the door, when people feel welcome and they feel a warm situation, they're more likely to kind of unpack their trauma. So professionals under. Oh, someone, okay. And let's see, I don't see any more questions. So I urge folks, if they have any questions, to please, throw that into the chat, or we're watching Facebook Live as well to see if anything comes through there. I don't know if, I want to touch base on something that the sheriff had mentioned. So you had talked a little bit about the domestic violence resource team. Many years ago, an officer friend of mine, Officer Mike Rucius, he knew of my experience, knew of my interest in potentially looking at a volunteer opportunity with the Hillsborough Police Department, and being able to go around and ride with officers in situations where domestic violence call comes in. But I imagine, and they have great teams within Hillsborough, and probably also I think what you mentioned with the county. But I imagine that looks a little different right now in our crisis. Are you still able to have those volunteers go into these homes and do that type of, and maybe walk through what that officer might do in that situation, or that domestic violence resource team member?
Well, that's a great question, Janeen, thank you. So our domestic violence resource team, they're the principal patrol investigators that follow up on domestic violence in crimes, and they have access to detectives as well for support and assistance. And if an investigation gets really complex, then that's where detectives come in and provide that support. They do risk assessments. So deputies on scene of a domestic violence incident, if it doesn't rise to a criminal, where there's probable cause to make an arrest, then there's safety planning that happens on the scene. There's threat assessments that happen on the scene. And then following up on the domestic violence resource team, they do an additional assessment just to make sure that if there is lethality, that potential is really recognized in a thorough manner, and that we are just double checking our work along the way. Access to our nonprofit and volunteers, that's still happening. Where we can do that by phone and still be effective, I mean, that's what's happening. And when it's appropriate, and when it's not appropriate, we're still on the job. We have to get there in person. If we have to mask up, we're going to mask up. We're going to get there, and we're going to intervene and do what we need to do to protect people. And I might just add to Representative Sollman, you brought it up. It's not just the Sheriff's Office, but the Hillsborough Police Department has a very effective domestic violence resource team. Beaverton, the Tiger 12, they're all focused on domestic violence. And I'll tell you one of the reasons why, and it might sound a little selfish, but it just, I think it underscores the importance of addressing domestic violence. Unchecked domestic abusers are the group that is most likely to ambush police officers. And so it's important for us to protect survivors and address this public health and public safety scourge that is domestic violence. But we also know, and statistics bear this out, domestic violence it continues to be the most dangerous incident that police officers across this country respond to. So we're very aware of the potential for lethality, both to those who are involved, as well as the service providers, both in uniform and our volunteers.
I'd like to pick up on something that the sheriff just mentioned regarding the lethality of domestic violence. A significant number of the homicides that we see in Washington County, the murders that happen throughout the year, when we look at the perpetrator of that homicide, there is a significant link to domestic violence. So a number of those people have a domestic violence past, and a number of those homicides actually started out as domestic violence scenarios that elevated into a death. So sometimes the line between what might be a lower level misdemeanor, assault, a simple assault, and obviously the most significant of all crimes, a murder, sometimes that line is a very thin line, and these abusers cross that line. And when that line is crossed, it wreaks havoc on the families, and obviously you have a death that occurs. So we are extremely concerned about the lethality that we see in domestic violence. And again, that's another reason to shine the light on what's happening behind closed doors. Not long ago, about a generation ago, when we talked about what happens in a family home, people used phrases like, it's a family matter, or let the family figure it out. If I pull old files in my office going back to the 1980s, and I read the way things were written about when it comes to domestic violence or even child abuse, there was a very different mentality about things happening in the home should be dealt with by people in the home. And thank goodness we don't have that approach anymore. But there are still people out there who believe that they can hide this abuse and make it so that the victims and survivors don't seek the help they need. And we need to put a stop to that by shining a light on it.
Thank you so much, DA Barton, for bringing that up, because it was a thought when you were talking about that, Sheriff. You know, I am just not, I'm not ashamed to share that personal story, because I feel that from that, I'm hopeful that people can garner strength in knowing that there is a pathway out. And I want to say that growing up in this situation, it was exactly how you described. That if a police officer did, and we lived in the country, so if a police officer did happen to come, there would be a, you know, okay, how you doing? Okay, you got it all under control. Everyone seems, you know, my mom and my sister and I would learn to utilize that opportunity of when that police officer would come. That was our escape. And that was our way to get in the car and get out of there. And so now with changes in law, because it's that shedding of the light and it's that understanding and unpacking all the situations that are happening, and knowing that that's very different now when a call is made is I just want to say, you know, thank you to that change. I thoroughly believe that we are saving lives in situations. It's some of the reasons why I have been so passionate about gun violence prevention issues. You know, statistics know that when a gun is present in a home, that in a domestic violence situation, a woman is 5 times more likely to die. And that's something that I utilize that experience from and try to create positive change at the state level. So I just wanted to bring that forward. So I do know I see another question had come. Oh my goodness, where did time go? And here we are. Look at that. We're almost done. I wanted to hear how the public safety levies money assist in all the issues that we've heard about today. So I'm not sure if that can be discussed, or if anyone.
Yeah, it absolutely can. I can take a stab at providing part of the answer, and I know the sheriff can as well. The public safety levy is on the ballot currently, that people have probably sitting on their kitchen counters, if they're like me, waiting to fill out and turn in before May 19th. Washington County has a public safety levy, which is up for election essentially every 5 years. This year is a continuation of the levy we've had for 20 years, but it also adds new services. And so it's called a replacement levy because it adds something new and continues what we've had for the past 20 years. The levy supports roughly 16% of all public safety services in the county, which includes everything we've talked about here today. It funds the sheriff's office, the district attorney's office, the county juvenile department, which works with juveniles and youths who commit crimes before they're involved in the adult system. It funds community corrections, which is the parole and probation officers that supervise offenders who've committed these crimes to make sure that they remain supervised in our community. It also funds many of our domestic violence shelters and the shelter system that provides shelters for victims and survivors of the very situations that we're talking about here today. including funding that is used by the Family Justice Center and DVRC. So it really is, in some ways, part of the glue that helps to hold together our public safety ecosystem.
Thank you. Anyone else? Oh, Sheriff?
The levy funding really enables us to assign a detective to the Family Justice Center. It's just part of that kind of community of resources that are available to help domestic violence survivors and those at risk. And the kind of the ecosystem, that public safety ecosystem that Kevin described, it's, you know, the municipal departments, all of our police agencies in the county, for them to be effective at the good work that they do, that infrastructure is really important to be in place to do that. So yeah, it's just an important decision. For those that haven't voted, just encourage that that you do that. And thank you for the question.
Yeah, I just think it's really, you know, as someone who has visited some of these courts that Washington County, whether it's the Veterans Court or the Drug Court, the systems that have put in place, especially that peer system of support, and having the officers that are directly involved in some of those. With, I think most recently I was in the drug court watching a graduation and watching a check-in type of wraparound service, I would say, that they provide. I'm really amazed at those opportunities, because it is about trying to help people, guide them in that pathway to bettering themselves and giving them the supports that they need to take a different turn in their life. So I think we have come to the end, and I really just, I thank the professionals that are here today, giving their incredibly valuable time to share these resources, knowing that folks can call up to the Family Justice Center, calling the DVRC line, knowing that there's just a phone call away, whether it's during an incident that they know that the sheriff or the Hillsborough Police Department or any of our local folks are ready at that 911 call to help. We all don't operate in silos, right? And I think this discussion just really highlights that. It takes this village to help each other. And I think all these different resources that we have together to help protect our citizens and our constituents make us a stronger society. So thank you so much for giving your time today. Thank you to Maria Johnson for providing the ASL support to broaden our reach. Thank you to those that have tuned in and listened and shared your questions. And again, be safe, stay well, and enjoy the rest of your day. Thank you.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye.